Hello, Psyche community, and welcome to today's webinar, Professional Mental Wellness, the Role of Organizational and Occupational Health. Thank you for joining us. My name is Dennis Schaller, and I am a clinical and scientific liaison for Otsuka Pharmaceutical Development and Commercialization, Inc. And I will serve as the moderator for today's discussion, featuring Dr. Gaurava Agarwal and Dr. Sean Maloney. Now, before we begin, this slide shows our rules of engagement for this Psyche webinar. And for our audience, please do take a moment to familiarize yourself with these rules of engagement, but please do not hesitate to reach out to our team should you have any questions regarding today's presentation. As for disclaimers, this program is paid for by Otsuka Pharmaceutical Development and Commercialization, Inc. and Lundbeck, LLC. I am a paid employee, and Dr. Maloney is a paid employee of Otsuka. And Dr. Agarwal is a paid consultant for Otsuka as well. I am pleased to be joined by our two featured speakers, Dr. Gaurava Agarwal and Dr. Sean Maloney. So first, Dr. Agarwal is the Chief Wellness Executive at Northwestern Medicine, the Director of Faculty Wellness, and Associate Professor at Northwestern University, Feinberg School of Medicine. Dr. Maloney is the Director of Occupational Health and Safety for Otsuka America Pharmaceutical, Inc. So Drs. Agarwal and Maloney, thank you so much for taking the time to participate in what will certainly be, I think, a robust discussion on professional mental health. And to kick this off, let me just start by reviewing today's presentation objectives. So in today's presentation, we will define and describe organizational wellness, and we will discuss strategies for the prevention of depression, burnout, and occupational stress in healthcare professionals at a systems and organizational level. We will describe the role of organizations and leaders within an organization on promoting burnout prevention and wellness strategies for employees. And finally, we will provide best practices to ensure the wellness of healthcare professionals within an organization and examples of organizational wellness programs that are currently in place. So a jam-packed agenda. So let's dig into it. And I'd like to open today's presentation actually with a quote here. And you can see this is from the World Health Organization's previously proposed definition of mental health. Now, the WHO defined mental health as a state of well-being in which the individual realizes their own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. So, Dr. Agarwal, I'd love to turn this over to you. And I believe that you have a quote, actually, perhaps from Freud, that comes to mind when you hear this definition. Would you mind elaborating on that for the audience?
Sure, Dennis, and thanks for having me. One of the things any good psychiatrist does is find a way to quote Freud and see if he had any thoughts on the subject. And the one that I came across was this idea that he said that work and love are sort of the foundations of our humanity. He goes on to say that the capacity to work and love are the markers of good health. And so to me, that really highlights this idea that if we're not able to work, if we've become disabled or impaired, that's a sign that our health is challenged. And I appreciate the World Health Organization's definition here, including this idea of being able to work productively and fruitfully.
Thanks so much, Dr. Agarwal. And I think that's a good thing to point out in kind of setting the frame for today's presentation. And even before we dig into it further, I think it's important for us to disambiguate these two terms we might see in the presentation, right? Occupational health and then organizational health. So Dr. Maloney, if you wouldn't mind, could you weigh in on this for our audience?
Absolutely. Thanks, Dennis. And just have to say, when you look at the subtitle of the actual presentation, organizational and occupational health, our friends in psychiatry also put together a wonderful definition of that term, right? So it's adapted from an article in the Psychiatric Times, if I'm not mistaken, where we extend our medical knowledge to the day-to-day functioning of individuals in the workplace and organizations. So the goal there, helping each function optimally. You'll see throughout that theme will be recurring, but it's important to split the two, right? So organizational health, think about that on a macro level. So these are issues that relate to the functioning of the larger organization. So things you can measure, right? So is the organization agile? Are they flexible in how they deliver their business? Are they accountable? Do they reach goals that they set out to reach? And are they well aligned, right? Do colleagues understand what expectations are of the organization? And when you talk about occupational health, you're really looking at the micro or the personal level. So you're talking about issues that are related to individual work-related health concerns. When I think about it, and when most docs think about it, how the workplace or the work itself affects the health of the individual and vice versa.
Thanks so much, Dr. Maloney. I think that really does set the tone in disambiguating some of those terms that we'll see today. And so I appreciate it. And with that, I think, as we reflect on that definition really from the World Health Organization, we can see the potential need for organizational wellness here, as you described. And, in our work sphere, I think it's abundantly clear that healthcare professionals are susceptible to burnout. And so, Dr. Agarwal, love to hand it over to you to discuss, not only the need for organizational wellness among healthcare professionals, but also the broader sort of historical body of research on occupational health.
Sure. I think, as we see on our slide here, there's some clues from the data, and i.e. that burnout is prevalent across all health disciplines. And the percentages of folks that are reporting or screening positive for burnout are incredibly high. And if this was an issue of that could be solved at purely the occupational level, i.e., like what Dr. Maloney spoke about, just the personal level, then these percentages and the widespread prevalence don't make sense, right? It seems odd that so many people across so many disciplines in our industry would be struggling with the same thing if this was a personal health issue. The fact that it is so widespread, the fact that it is so prevalent, argues strongly for the organizational component and the systems drivers that are contributing to the overall burnout that we see amongst our healthcare professionals. I think from a historical perspective, the quote that I still do love, cliche, but this idea of they used to send canaries into coal mines to see if the coal mine is toxic. Well, if the canary died, obviously that indicated some toxicity. And right now, our job, I think, is not to make stronger canaries. It's to actually fix the coal mine that we all work within. And so that's the organizational part that I love to focus in on. I do want to make sure that people recognize that this is a classic case of yes and. I don't think it's an either or issue. I definitely still, I'm a psychiatrist, I'm a coach, I believe in the individual's responsibility to craft a life that works for you, to craft a career that works for you. But I also think that the largest bang for the buck here will come from organizational level changes.
Thanks so much, Dr. Agarwal. And the canary in the coal mine, I think, is a great phrase to use to describe this situation. And we can see on this slide that burnout is highly prevalent, especially among healthcare professionals. But we also wondered, what do the current data tell us about how physician burnout has changed in recent years? And so we turned to a slide like this. And again, Dr. Agarwal, would love for you to take our audience through these data and to really differentiate some of the terms that we may see on a slide like this.
I think what you're seeing here is from the largest national survey of physician burnout. And what you're seeing here is that the first time it was measured in 2011, it was at 45.5%, starts to increase at 2014. They measure every 3 years to 54%. And then hopefully, it's hard to know what does what, but the attention to this topic started to create momentum and change best practices. You started seeing dedicated resources, dedicated roles such as mine in terms of chief wellness officers. And our hope was we were starting to make a dent with this peak of 54.5% in 2014, starting to trend lower. They measured again in 2020. And I think a lot of people expected the numbers to spike. But what we know about disasters is actually right after the disaster hits, there's what's called this honeymoon phase. And actually, there were lots of changes in our healthcare environment that were addressing the very difficult challenge of the pandemic, yes, But a lot of these changes, such as decreasing the burden of notes, telehealth, et cetera, actually allowed us to reimagine the way we deliver healthcare in a way that it's not surprising to me that we actually saw a lower percentage in 2020 in the midst of the pandemic. However, because it was so strange and because the pandemic didn't stop in 2020, the researchers decided to pulse check at the 1 year interval. And what we also know about disasters is after the honeymoon phase, there is a predictable downturn of morale. And I think what you're seeing in 2021 reflects the incredible challenges of the Delta wave, the reimagining of work and numerous other societal challenges. And so we see this spike in 2021 in physician burnout that we need to be really aware of. Because I do think this is a critical moment in protecting our healthcare workforce. I think the only other thing I'll note here is, in addition to burnout, they looked at depression, and they saw that the depression rates were increasing. And a lot of times people ask me, well, is there a difference between burnout and depression? And I want to say the answer is yes. Burnout is not a mental illness. It is a disruption in the relationship you have with your workplace. If you get away from your workplace, burnout improves. On the other hand, depression is a mental illness with treatments that are appropriate for that disease. And that if you took a week-long vacation from work, depression wouldn't change. It's more all-encompassing. There is a relationship that as the burnout becomes more severe, people see the comorbidity of depression with severe burnout starting to track. And so it's an important comorbidity, but they are different, and their treatments and their approaches to addressing them are different.
Yeah, thank you, Dr. Agarwal, for making that distinction and really for digging into the difference between 2020 and 2021. I think the honeymoon phase analogy makes a lot of intuitive sense to me, why you might see that dip in 2020 and then that increase back in 2021. And on that note, we'd just like to remind our audience as well that as a team here at PsychU, we have recently developed resources on the topic of occupational wellness as part of our 8 Dimensions of Wellness series, and that's housed on the Patient and Caregiver Resource Center of PsychU. And so we'll link those resources at the conclusion of this webinar. So just wanted to point that out as well. But, while burnout is pervasive, especially among healthcare professionals, we now know that there are approaches that employers can consider to promote and manage mental health in the workplace. So this slide, of course, visualizes a continuum of mental health and levels of prevention. So, Dr. Maloney, to really appreciate the content shown here, it would be great if you wouldn't mind taking our audience through these basic concepts, really, of prevention. For example, the differences between the different levels that we see here.
Definitely. Thanks, Dennis. So when we talk about approaches that an employer and organization can consider to promote well-being and manage mental health in the workplace, it's really important to consider the different layers of prevention and intervention as they relate to really the continuum that you see along the right-hand side, right, from well-being to mental health disorders. More on that from Dr. Agarwal later, but before we transition to those specifics, let's do a quick prevention primer. So the definitions in this model that you see here, they're going to look familiar for anyone who does any level of prevention in their work. We typically look at it in 3 layers. So I'm going to start actually one step up at the primary prevention level. So primary prevention really refers to intervening before health effects occur, right? So measures such as vaccination, altering risky behavior, stopping smoking, changing your diet, things like that. And that's really the word in parentheses there is really the key word, proactive. When we talk about secondary prevention, we're really talking about screening. So we're trying to identify disease in its earliest stages, so before the onset of signs and symptoms. For most people, you're going to be thinking of such tests such as mammograms, perhaps routine blood pressure screening, things of those nature. And when we look at tertiary, we're talking about managing a disease or a diagnosis to really slow and or stop progression. So talking about treating a disease, medication, chemotherapy, rehabilitation, screening and ensuring complications don't occur after the diagnosis, that sort of thing. Now, the really interesting component here is that first step all the way at the bottom here, the kind of largest piece of this pyramid, right? So primordial prevention really goes beyond what a lot of people might consider or think about when you think about individual level prevention efforts. And they more so address prevention at, you could call it a community level. And you're looking at social, environmental risk factors, things like level of education, awareness of issues in the community, things like that. So, Dennis, I hope that helps just kind of lay the framework a little bit for what we're talking about here when we're layering these general prevention concepts into health in the workplace.
It certainly does, and I appreciate it. I think it's a great primer, and I think it situates us well to turn back to Dr. Agarwal, because when the three of us got together and we're talking about this model prior, Dr. Agarwal had mentioned the importance of distinguishing really between, wellness or well-being and also mental health. And so, Dr. Agarwal, would you mind elaborating on this concept and really its relationship to the prevention levels that Dr. Maloney described?
Yeah, I think Dr. Maloney did a great job of highlighting how these preventative models work, especially at the individual level. His examples were what an individual might do in terms of, for instance, vaccination and smoking. For me, I use this model when I'm doing my organizational work in a very similar way, where I think of wellness as much more in that primary prevention realm, where can we fix the systems that we work in so that they don't cause as much stress, so they don't cause as much distress in the first place? So can we fix workflows? Can we help with the EMR to take burdens off of our clinicians? Can we figure out how to do team-based care? So instead of the clinician really doing every piece of the patient care, can we work as a team in a much more fluid and high functioning, high performance way to best serve our patients? That's really where I try to focus in from a wellness perspective. When we start going up the pyramid, particularly as we reach tertiary prevention, I think of that as, okay, now this person has actually developed a disease or is no longer able to function and no longer able to work. That is not the time where fixing the EMR is what we need to be focused in on. At this point, we really do need to, again, look at this person now as a patient because they developed a mental illness and they're no longer able to be functioning at work, and providing the specific resources that can help them regain their health, regain their functioning as soon as possible to minimize the burden of disease and impairment. And so that's just a little bit of the distinction I like to make here, because I think sometimes, especially as a psychiatrist, people say, oh, you're doing wellness stuff. Does that mean you're pushing counseling? And I say, well, that's one aspect of it. But actually, the wellness work is we really want to go back to fixing those goal lines so that people don't experience the distress and stress in the first place.
Yeah, thanks so much, Dr. Agarwal. And I think at this point, we somewhat introduce and start thinking about the specific issues that are really relevant to employee mental health. And to introduce a model that we can look towards is the total worker health model, right? And from a 30,000-foot view, total worker health seeks to improve the well-being of the US workforce by protecting their safety and enhancing their health and productivity, right? It prioritizes a hazard-free work environment. Well, Dr. Maloney will describe it much more eloquently than I will, but with that in mind, Dr. Maloney, could you please provide our audience with some background information on this total worker health framework?
Absolutely. So yeah, before we dive into those specific models and drivers of burnout, wellness at the organizational level, I think there's a few important questions to always ask, right? Is anyone looking at this? Is anyone researching this? Does anyone, who cares about it? And why should an organization care about it and dedicate resources to it? And if they do, how can they really conceptualize what we're doing? And well, the answer is we cared enough as a country to establish the National Institute of Occupational Safety and Health, or NIOSH. It was actually formed as a research organization in the 70s. Dr. Agarwal, it's probably the result of some of what was occurring in those coal mines was a driving force for why we actually put this into place. But this group, Dennis, as you mentioned, focuses on worker safety and health. We empower employers and workers really to create safe and healthy workplaces. And in pursuit of matching priorities to what's an evolving landscape in the workplace, NIOSH established something called the Total Worker Health Program. It highlights what you see on the screen here, 10 critical priority areas and emerging issues that are relevant to advancing worker well-being. In the context of our discussion today, I'd like to really highlight or pull out two of them. In my personal view, I think they're very important when you're talking in the scope of mental health. So the first one is in that bottom left there, organization of work. So we're talking about how does work get done? If you're talking from a standpoint of worker well-being, you're talking ensuring adequate breaks are occurring, resources are available to get the job done, safe staffing, ensuring employees view their work as meaningful and engaging. These are these key components to consider in pursuit of that comprehensive worker well-being. As we know, mental health worsens with chronic exposure to occupational stress, and those components we mentioned earlier can help alleviate some of that stress. So the second piece I'd like to pull out here is really top left, prevention and control of hazards and exposures. Probably looking at that and saying, I don't draw it, right? I don't get the line here. Hazards and exposures, what do they have to do with mental health? This is, in your mind, you're probably thinking this is a vestige of kind of old work or lots of manual labor, working in factories, things of that nature. But you got to define hazard first, right? So in the classic sense, you can broadly group them into 6 categories: safety, chemical, biologic, ergonomic, physical, and work organization. So stressors associated with workplace issues, including workload demands and workplace violence, fall into that last category of work organization. So you kind of see where I'm going with this. The organization of work and those corresponding psychosocial factors we mentioned, they're actually hazards or can be hazards that need to be prevented and controlled at the organizational level, just like anything else, controlling whatever toxic gas is in that coal mine to ensure that our employees are healthy. So, Dr. Agarwal, with that kind of background from my perspective, I'd really love to hear your view on how you define and really conceptualize what a workplace hazard is, specifically in your line of work as well.
Sure, I appreciate that. I think we look at it as there are demands of every job. Certain demands we've created that you can, if you design correctly, and you fix the ways we work, those demands can be removed from our jobs. And that's where we try to spend the bulk of our efforts. There are other demands, however, that are a part of our job that are inherent in the job, and you can't design around them. So in healthcare, for instance, one of the things that is a demand of our job is we will work with patients that will die. That is inherent in this work that we do. And that is a demand that every healthcare professional will have to face some points in their career, and I can't design around that. And so for us, those demands that we can't design around are what I think about as inherent hazards of the job, that we need to make sure that we provide sufficient resources to our workforce to be able to mitigate the damages or negative effects of that particular hazard.
Thank you both so well. I love the back and forth of not only setting up the total worker health model, but also conceptualizing what those hazards look like. And I bet our audience at this point, this inflection point, gets excited about potential ways to take action. And I think one of the ways we can address this, right, address clinician burnout and professional well-being, is to look to a systems model like this one, right, for guidance on how to take that action. So Dr. Agarwal, would you mind reviewing this model for our audience?
Sure. And before we do that, I would just want to say it's important to have a framework, whether it's total worker health or whether it's the National Academy's systems model, clinician burnout, is that when you're doing this work, right, I often get asked by people, you know what, I'm on the front lines, I'm a doc, I don't sit around in meetings thinking about all these different levels. I don't have any power or circle of control to address some of those different buckets that Dr. Maloney showed us around compensation or benefits, etc. What can I do? And this is where having a framework and recognizing all the different inputs that go into health or burnout prevention or professional fulfillment, whatever metric you want to look, allows us to say, I want to own this one small piece. Someone else has to own this piece, but I can make a difference on this one piece. And that is progress. That is how we will move this ball forward. That is how we will create a culture of well-being. Is we have to break down this big thing called burnout and professional fulfillment, where to something more bite-sized and manageable, and address one aspect of that. Otherwise, I just see so often people sort of give up before they even start because it's too overwhelming. Going to this framework, which helps me as I'm trying to plan and execute initiatives that can help our environment, I actually like to start in the middle of the model at the work system factors. And the work system factors are basically what we talked about earlier, the demands of our job and the resources that we are given to meet those demands. That is where all the work has to be done, in my view, is optimizing that balance between the demands of our jobs and the resources we have to complete them. That to me is what real wellness work is about. Now, what's important to recognize is those demands and resources are impacted differentially at different levels. So the demands of our jobs, certain demands of our jobs are demands placed on us by an external environment. That could be our payers, that could be insurance companies, that can be the government and CMS. All these various external bodies create both the demands and the resources that we face. At that next level, our healthcare organizations also impact how we experience some of these demands and resources. And then finally, at the most granular level, our individual teams within an organization impact those demands and resources as well. It's really important to figure out if there's a particular demand that is hard on you and your colleagues, is this demand something that can be addressed by either my organization or my individual team or department? Or is this actually a demand that is created far above all our pay grades at the central government level? And the reason that's important is if it's that one, you're going to pound your head against the wall a lot trying to address it and get frustrated and potentially give up. Whereas you would be better served using your energy, identifying demands or resources that you have control over within your individual teams or your organization. That's motivating to be able to see progress, and that can lead to a lot of great changes we've seen at our organization. Finally, all of these things don't preclude, again, the occupational part, right? Every individual still experiences these demands and resources differently. Even people on my same team experience the demands and resources of the job differently than I do, both who I am and what's going on in my life and all the other stressors that are a part of each of our lives that are frankly nothing to do with work. So we all experience all those things differently to give us the outcomes of either burnout or professional well-being and the resulting consequences of either of those two outcomes, to the point of what Dr. Maloney says, why do we care? We care because there's consequences in all these various stakeholders.
Thanks so much, Dr. Agarwal. It makes a lot of sense to me, especially what you mentioned about demands, what we can control at our own level versus the levels that are a bit out of our control. And I think the idea of pounding our heads against the sand resonates, and really taking a look back and thinking about where can we kind of incrementally make progress when it comes to all those demands that we face. So much appreciated. And Dr. Maloney, of course, would love to turn to you for any commentary that you might have on this model as well.
I certainly, after that articulation, I wouldn't dare try and actually make a comment on the model itself, but rather just highlight Dr. Agarwal. I think you mentioned something that was so important and that we hear all the time is you're talking about organizational well-being. It's so easy to get caught up in the weeds, right? And struggle to find a starting point because there's just so many factors at so many different levels that contribute to the whole picture that we're looking at here. So I think that's why having a systems model like this really helps us. Using a systems model can start to apply that theoretical understanding and start to integrate some of the practical, right? So when you're talking about organizational and occupational health, really focusing on those complex interactions across individuals, work units, organizational levels, national factors, all those things as really drivers of things such as burnout versus engagement for the profession. Dennis, I think if you jump to the next slide, start to get these concrete examples of different work systems factors. That being said, Dr. Agarwal, I know you have a really eloquent way that you move through these examples. I'd really love to hear you kind of take us through what are those different things that you could do at these different levels to bridge the gap really from that, what we call the theoretical model, really to the practical application in everyday life.
Sure. Might be easiest to just take one of these drivers here. How about we take efficiency and resources and sort of see how that particular driver of burnout can be addressed at each of these different systems levels. So efficiency and resources, if you hang around the healthcare world, again, the word EMR always comes up, electronic medical record, as the bane of people's existence. And so if we use the EMR as a driver of burnout or fulfillment, at the individual level, we also have a role in improving our proficiency of using the software. Whatever software you're using, you want to be good at it. And if you're good at it, you're going to be more efficient. You're going to be able to complete your notes faster, hopefully have a higher quality, and obviously provide good care. And so at an individual level, it is on me to do the trainings that are provided so that I'm proficient. At the work unit level, for my particular department, is there a way that we can not necessarily change the software, but is there a way that we can change how and who documents what, so that the burden of documentation doesn't fall solely on one team member, but it really allows, for instance, a whole team to put in various aspects of the note that they're most well equipped to do. On the other hand, it could be that the work unit says we're going to provide various tools that allow us to either dictate our notes for people that don't really enjoy typing, or have scribes that other people can use. At an organizational level, the organization can make sure that they provide sufficient resources to have good training. The organization interprets different laws and compliance things in very different ways. And that's something a lot of people don't realize. Is a lot of people say, hey, this rule is the reason we have to do this, but it's usually the interpretation of the rule that results in people doing things a certain way that can add a lot of work. And so the organization can look at their compliance office and say, hey, you know what? We can interpret these regulations in this way that doesn't increase burden so much. And at the national level, I think there needs to continue to be a lot of advocacy about, well, what is the purpose of this note? Is this a billing instrument? Or is this actually about patient care? There should be advocacy to the makers of the software to say, look, my 6-year-old knows how to use an iPad because it's incredibly easy to use. Why is this piece of software so difficult to actually learn? And what can we do to make it easier? And so at every level, there is work to be done for us to experience the maximum benefit.
Thanks so much, Dr. Agarwal and Dr. Maloney. I think we really promised on the part of a robust discussion about what we discussed today so far. But I think that this is a really exciting part of the presentation, because we have the opportunity to put all of this information together and really visualize examples of organizational wellness that currently exist in the workplace. So, Dr. Agarwal, Dr. Maloney, I'd love for you to provide some examples of organizational wellness programs that exist in your professional circles. Or if an example doesn't come to mind, the question would be, what would an ideal or an aspirational example of an organizational wellness program look like? So Dr. Agarwal, I think I'll turn to you first.
Sure, I think maybe I'll continue to build off an example we gave earlier about an occupational hazard of healthcare, right? Again, going back to this issue that an occupational hazard in healthcare is that we will experience patient death and loss. that we will be involved in an adverse event or a medical error. And so what resources do we have to provide our employees who we know will be experiencing this hazard? And so historically in healthcare, there's been a culture of silence, shame, and blame. And what happens oftentimes after an adverse event is you sort of hunker down and you isolate and you have to deal with all of that, all of those emotions by yourself. And that is very difficult. And the data is pretty clear that it has adverse events on our healthcare workers' health. And so an organizational initiative that was created in response to that recognition of this occupational hazard is peer support programs. And so what we see in the physician world is physicians do not tend to bring this up on their own. They don't want to talk to HR or employee assistance programs about it. They want to talk to other doctors who know what it's like. And so my organization and organizations around the country have created these peer support programs to proactively reach out to folks who we know have been involved in an adverse event, or a patient has been hurt or died, and we reach out and trained physician colleagues reach out and say, we heard it might have been a very difficult day. I want to know that we're here and are trained to provide support to you during this time and know what you're going through. And these programs are hugely catalytic in sort of helping not only on this specific hazard, but beginning to break down some of these barriers to this culture of wellness and the stigma that often comes with some of the issues around mental health and well-being in the healthcare world.
Yeah, thanks so much, Dr. Agarwal. An amazing example to carry through and a great example of how to utilize peer support as well. And with that, Dr. Maloney would love to turn to you for the same question. Any concrete or aspirational examples of what an organizational wellness program might look like?
It's interesting that you started with that example, Dr. Agarwal, because part of what I was going to preface my example with is a brief kind of background, right, on understanding the importance of your value proposition for anything from a organizational wellness standpoint. So simply stated, knowing your audience, right? Who are you trying to project this program onto? Who are you trying to get to take up the program? And I think you just kind of nailed it there with that peer-to-peer support level, right? Anytime we're trying to launch or convey some form of the importance of a wellness program, we run through multiple value streams, right? So if I'm talking to finance about something, you're going to talk about direct cost savings. If I'm talking to talent acquisition in our organization, I'm going to talk about this program will make us an employer of choice and more attractive in the job market. If I'm talking to a physician colleague, as Dr. Agarwal mentioned, where's the value, right? They have to see and understand what they're going to get out of this program. So it reminds me of actually something we launched about 2 years ago, which would appear at surface level to really be a very typical kind of lunch and learn program. But if you actually peel it back and look at the layers, it's a lot deeper than that. Anytime we're pushing out this level of kind of organizational educational program, we look at aggregate claims data. We look at reports from our insurer. We look at our demographic information, age of our employees, how many dependents they have, what age they may be, to tailor content, right? So it's all tying back to that value proposition. Classic example. This isn't one that we've specifically used, but another organization I know of used is February. Everyone is always looking at American Heart Month, right? So a typical product you'd put out would be focus on cardiovascular health. You put out a webinar on hypertension, risk for myocardial infarction, and risk factors you can look at from a prevention standpoint. An organization looks at their data and says, we don't have many individuals in the typical age range. We don't see hypertension as an issue across our organization, but the overwhelming majority of our organization has kids that are under 18 years old. So that organization rolls out during Heart Month a focus on preventing sudden cardiac arrest and sudden cardiac death in kids and adolescents. So they took that understanding of value streams symptoms and took an understanding of their organization and built a program around that. So from my perspective, kind of what an aspirational program looks like is one that's tailored, one, to the makeup, but two, to the needs of the organization. And I think that really builds Dr. Agarwal and that kind of peer-to-peer support. It's all based on what is the individual that you're targeting with the program looking to get out of it? How do you reach that?
Right. Thanks, Dr. Maloney. Yeah, that value proposition, I think it's a great example, and love the pairing of your example with Dr. Agarwal's example as well. You know, it pains me to say, and I think that we can all agree that we wish we had more time to dig into this a little bit more. And even just deciding what to tackle in today's presentation was a challenge. But, you know, in closing for today, would really just like to thank you both for engaging in this discussion. You know, when it comes to professional mental wellness, it's something that is so important and concerns all of us. So we, as always, appreciate your contributions to our psyche community. And, you know, we're grateful for you taking the time to lead today's discussion. And so with that, you know, we'd just like to remind our audience of how and where to access content like this on the psyche.org website. And there's an app for that now, right? You can check out the Psyche app. It can be downloaded from the Google Play or the Apple App Store. And of course, for these fun-sized, kind of bite-sized versions of our Psyche content, and to keep up with the latest content that's being added to Psyche, we encourage everyone to subscribe to the Psyche Community Podcast, also available on Google Podcast app or the Apple Podcast app. And lastly, we are all over the place on social media. You see LinkedIn, Twitter, and YouTube here. So feel free to check us out there. And if you're interested in learning more about future events that we do, maybe with Dr. Agarwal and Dr. Maloney, or if you want to request a live presentation in your area, please do check out our link here, psyche.org/events. There are clinical and scientific liaisons like myself all over the country that are able, willing, and excited to deliver one of the many presentations within your community of healthcare professionals. So with that, and on behalf of myself and Drs. Agarwal and Maloney, would like to say thank you for tuning in to today's webinar, and we look forward to seeing you again at a future Psyche event. So thank you.